Okay, so we're doing the Australian health policies. It's by Naya, Juanita, Sterling, and Obeda.
So we're going to start off with the coverage. Australia has a program known as Medicare, but don't get that confused with the Medicare that we have in the United States, because in Australia they have a universal public health insurance program. Juanita will go more in depth, but this program is financed by general tax revenue and a government levy. Australia does have the only continental universal healthcare system, and along with Medicare, private health insurance is also available for people to purchase. Private insurance works with Medicare to cover other fees and services that may not be completely covered by Medicare. And then Medicare covers inpatient care in public hospitals, most medical services, and prescription drugs. The federal government also steps in Australia to cover cancer screenings and vaccines for targeted populations. So they do a lot of public health screenings as well. And then the federal government also comes in and works with the local governments to provide population health, mental health, some dental care, some physical therapy, and services for veterans. And then there is supplemental coverage in Australia, and it covers extra costs like private hospital care, dental services, vision services, physiotherapy services, and more.
All right, thanks, Sterling. Now I'll be talking about how Australia's healthcare system is financed. Australia funds healthcare mainly through general tax revenue and a 2% medical levy that's added to people's taxable income. This helps ensure everyone contributes fairly to support universal coverage. To keep care affordable, the government uses safety nets that cap annual out-of-pocket costs, especially for low-income or chronically ill patients. They also control national spending through drug price regulation and hospital budgets and promotion of generic medicine. So overall, this system balances shared responsibility and cost control, making healthcare both accessible and sustainable for Australians.
So now I'll be talking about affordability in Australia's healthcare system. Overall, healthcare in Australia is considered very affordable because of its universal Medicare coverage, which means everyone has access to care regardless of their income. This public coverage is the reason most Australians don't worry about high medical bills the way many Americans do. Out-of-pocket costs are also relatively low. They make up about 13% of total health spending, which is much less than in the United States. That means most people don't have to pay large amounts when they go to the doctor or hospital. Another reason healthcare is affordable is because of the programs like the Medicare safety net. Another reason healthcare is affordable is because of the programs like the Medicare safety net and the pharmaceutical benefit scheme. These programs refund people once their spending reaches a certain amount in a year and make prescription drugs more affordable for everyone. Australia also uses something called bulk billing, which lets doctors charge Medicare directly. So when people visit a bulk billing clinic, they don't have to pay anything out of pocket for that visit. And finally, there are protections for low-income and chronically ill patients that make sure they aren't left struggling with high costs. Altogether, Australia's system really focuses on keeping healthcare affordable and accessible for everyone.
Okay, so for the quality of care, we have our strategies that they use to maintain quality of care. One is National Healthcare Agreement of COAG. This agreement sets out the main objective for healthcare organizations, which is a sustainable system with improved outcomes for all. Number 2 is the Australian Commission on Safety and Quality in Healthcare, which is responsible for safety and quality improvement in healthcare. And number 3, Australian Council on Healthcare Standards, which is a non-government organization that accredits providers. And 4, a National Health Performance Authority, which reports on the comparable performance of local hospital networks, public and private hospitals, and other key health service providers, but not nursing homes or home care agencies. Are these strategies working? In Australia, the infant mortality is 3.7 per 1,000 live births, in comparison with the world's infant mortality rate of 27 per 1,000 live births. The maternal mortality rate in Australia is 5.3 per 100,000, and Australia has one of the lowest maternal mortality rates. The life expectancy in Australia is 83.1 total, with 84.9 for females and 81.3 for males. The average life expectancy in the world is 71.4. And then with rates of chronic disease in Australia, it is 18.9% of people have anxiety, 15.7% people have back problems. Depression has a rate of 12.4%, 10.8% people have asthma, and 9.6% of people have deafness or hearing loss. Now, in comparison to the world, it's hard to estimate the differences, but you have to keep in mind that there are over 8.1 billion people in the world, and Australia is 27.2 million people. So, in comparison to the world, 4.4% of the world have anxiety, which is equivalent to 359 million people. And then 8 to 9% of the world have back problems, which is 619 million people. And then in the world, depression rates are 5.7% of adults. And then for asthma, 262 million people have it. And then deafness or hearing loss, 5% of the world's population. So in comparison to the world and other countries, Australia is doing a lot better with their quality of care. So for provider satisfaction, we're looking at the rates of medical school and how easy it is for providers to get their degree. For medical school affordability, people who live in Australia, their price for their medical degree is around $60,000 to $75,000 for the whole time, and it's about $10,000 per year. And then for international students, it is $300,000 to $400,000 for a medical degree, because international students pay full tuition fees. You can, however, get scholarships for domestic people who live in Australia. You can get scholarships from universities and government assistant programs. And then for international, you can get merit-based scholarships. And then in regards to compensation for providers, the average salary for a doctor is $101,000. And however, the experienced doctor's salary is $200,000 to $300,000. So if you look at it, if you're an international student paying for it, it's not really worth it to go to medical school in Australia. But if you are a person who lives in Australia, the compensation would be worth it. And then the job satisfaction as of 2025 is 59% of providers were extremely or moderately satisfied in a study done by the National Institute of Medicine.
So for the first policy strength, I've said that universal public health insurance is really beneficial. Australia's Medicare program provides insurance for all Australians and even some visitors. And then the strengths are just that it ensures everyone has access to health care. Hospital care is often free when you visit a public hospital. And then other services are also covered, and if not, there's a very minimum out-of-pocket expense. And it also gives people the choice to also purchase private insurance to cover further costs. And the U.S. could benefit from this because it provides 3 benefits, clear benefits. It improves patients' health outcomes, increases health equity, and there are also economic benefits to this. So for the improved patient health outcomes, universal health care ensures that everyone has access to necessary medical care. This access results in better preventative health and early detection of diseases, and there are also less financial barriers whenever it comes to patients paying for care. There's better health equity because universal health care ensures that everyone has access to health care regardless of income, employment, or demographics. It also reduces health disparities among different socioeconomic groups. And then for economic benefits, with improved health outcomes, leads to a more productive workforce and reduced healthcare costs for businesses. And there's also been found that there's economic growth that is stimulated by universal healthcare.
The second policy strength I thought would be a great benefit to the U.S. was the Medicare levy and safety net system. This policy ensures steady national funding through the Medicare levy. Now, what is the Medicare levy? The Medicare levy is an Australian government program that provides more money back for out-of-pocket medical costs once you reach a certain threshold in the calendar year. So we can break this system into two. The Medicare levy, where every working adult pays a small amount of their income to the government, and that government uses that money to make sure everyone can see a doctor or go to the hospital affordably. And the other part is the safety net, which is like a protection shield. So once you've paid a certain amount of the out-of-pocket in a year, the government says. And the other part is the safety net, which is like a protection shield. Once you've paid a certain amount of out-of-pocket in a year, the government says, okay, you've spent enough. We'll start paying a higher percent of your medical costs for the rest of the year. So this helps people who get sick often or are chronically ill. This is a strength in my opinion because it combines equity and financial stability because everyone contributes. This is a strength in my opinion because it combines equity and financial stability because everyone contributes but no one is left behind because of high cost. If the United States adopted something similar, it could help reduce medical debt and make healthcare costs predictable for families.
So for policy strength number 3, I chose the National Agreement of COAG. This agreement sets an objective for quality care and health care organizations in Australia, and it is stated that a sustainable system with improved outcomes for all is the objective that Australia gives for their healthcare organizations. So the strengths I have for this is it ensures providers have a definition of care. It puts guidelines in place for healthcare organizations, and it would highlight areas for reform, such as addressing major chronic diseases and their risk factors. And then finally, it would implement benchmarks for care. How the U.S. can benefit is, one, implementing a rigid benchmark system into the U.S. healthcare would keep providers and organizations in line. As we know, U.S. healthcare has been known to be unfair for a lot of different groups of people, and a lot of people in different socioeconomic groups. So having this national agreement and a rigid benchmark would allow for more equality in healthcare. And number 2, the agreement would give the government or organizations places to focus on reforming in order to benefit the future of healthcare. So we can look at things that need reform, such as lack of proper documentation and excess in chronic diseases. And then these benchmarks will allow us to address these further.
So for the fourth policy strength, I chose Pharmaceutical Benefits Scheme, the PBS. So the next part, I'll go over one of Australia's major policy strengths, which is the Pharmaceutical Benefits Scheme, also known as PBS. This program makes prescription medicines more affordable by having the government subsidize most of the cost. It ensures that people can get essentially medicines at low fixed copayment. The PBS also includes a safety net program that helps patients who need several prescriptions each month, which is especially helpful for people with chronic health conditions. What makes the program work so well is the Australian government negotiates drug prices directly with the pharmaceutical companies. That helps keep the overall cost of medicine under control nationwide. The strengths of this policy are clear. It reduces medication costs for everyone, improves access to treatment, and keeps prices consistent all across the country. If the U.S. adopts a similar idea, it could lower prescription prices nationwide and help reduce the financial pressure on people who rely on multiple medications to stay healthy. So overall, the PBS is a really strong example of how Australia uses national policy to make healthcare both affordable and effective.
And finally, this is our works cited page. And then thank you for listening.